I got diagnosed with breast cancer in 2022. I was finishing up my second year of law school, and when you hear cancer, it's just like your whole world kind of stops, and just decided I was going to take a year off to deal with whatever this was going to be. And then I came for treatment here at Georgetown, where overall I've had a great experience, and I feel like God placed the right people on my team, and it's a blessing that I was able to get my care here at Georgetown.
You know, she was in her 20s and now dealing with a cancer diagnosis. And she and I connected. I felt the need to take her under my wing and be her guide during her journey.
I think it took me a little while to process what was going on, and I think I was just like, I feel fine, nothing hurts, I'll be good. And she was just kind of like, no, this is gonna be a tough fight, and you know, you have a good team, but also like we need to start getting this taken care of.
I think initially she was in shock of her diagnosis, and so I told her, Grecia, you need to make a decision. You need to have treatment. And so I think she heard me, and I said, I am like your big sister. You need to tell me, how do you feel? What are your fears? And I'm here for you, and your family's there for you. But I'm your provider, but I'm also your friend, and you need to listen that you need treatment.
I met with Dr. Maynard. She is amazing. Initial conversation, she hit me with a lot of like side effects from the chemo.
When patients are younger, there's many things to consider. One important thing is fertility preservation, and if patients wish to go that route. So whenever a patient has cytotoxic chemotherapy, there is a risk that it could affect a woman's fertility later in life. And so we usually try to refer our patients to a reproductive endocrinologist before we start therapy so they can discuss the risk and benefits of going through some type of fertility preservation.
I went through the chemo and asked a bunch of questions throughout the whole process. Dr. Maynard has been such an advocate for me. I feel like she's one of the smartest people I know. It's amazing just how like she has the patience to stay with me and just go through each question, and she'll be like, okay, what else? Like no question is stupid, which is good as a patient to be like, okay, I'm being heard.
We got about halfway through therapy, and then her tumor started to grow, which can happen in rare cases. We immediately sent her back to Dr. De La Cruz to undergo her definitive surgery.
She told me, I don't want to look different. You know, I'm in my 20s, I'm single, I'm dating. How am I going to do that when I'm done with surgery? And I told her, Grecia, don't Google, because you won't find my results in Google. And I always tell that to patients because I went into this field to treat women, to take care of patients, to create bonds, but mostly to make a difference. The work of breast cancer treatment and surgery has evolved, thankfully, in the last 10 years, with better implants, better reconstruction. You don't have to look like you had cancer. You could actually look better or even forget that you had cancer.
I feel like as a woman, you hear breast cancer and you're like, okay, I'm gonna lose like my breast and I'm gonna look different. And so it was great to work with Dr. De La Cruz and Dr. Song. They've been amazing. They really helped me a lot.
The real exciting thing in breast reconstruction now is the ability to connect nerves, and in some patients to restore sensation after a mastectomy and reconnecting the nerves to give that sense of feeling and wholeness to the reconstructed breast. Patients not only survive but really thrive after cancer treatment. We give them hope and the ability to really restore what cancer has taken away.
So it was really amazing because I love how I look, and also thankfully right now I'm cancer free, thank God. I'm really faith-based, and that's what grounded me throughout this whole process, just like having so much gratitude for all the things that I did have access to.
I follow her on Instagram, and I know she's doing great in life and she's enjoying her time with her friends and her family. You know, this is the reason why I became a breast surgeon. And Grecia is just one of those people that have sincerely touched my life.
And now I'm finishing up law school, which is great. But again, I think now with this whole different lens to look at life, which is amazing, of like, hey, we're not just guaranteed life, you know, just because you're young or because if you feel healthy. But now I get to dream, I get to explore and go on adventures. And so I'm just so grateful. Now I get to go forward with my life. And it has been such a great blessing.